Hello, Doc.
Hello, Doc.
Great conversations and education on relevant health issues management. Hello, Doc.
Hello, Doc.
Make a date with our health professionals on the drive with the area gang. Mondays 2:45 to 3 p.m. Hello, Doc. Hello, Doc.
Hello, Doc.
Okay, so Doc is here. Dr. Emefa Dzide is here with us on Hello, Doc. Good afternoon, Doc. You're welcome. It's been a while. It's been a while. How have you been doing?
By God's grace.
Everything is fine, eh? Yeah. I'm also good. You didn't ask me. I'm also good. Today we're taking a look at stomach ulcer, right?
Yeah.
But before we get into stomach ulcer, we've got a concern from a listener that I would want to share with you, and if you have some advice to give our listener, then we can get into it. But don't forget that if you have any health challenge that you want doctor to speak on, you can always send us a WhatsApp message on 0505751151. That is 0505751151. Any condition at all, doctor will try to address it and of course direct you to the right core test. But today's message here from a listener who wants to remain anonymous. He says, "Hello, Doc. Please, I'm suffering from this severe pain in my right leg. I've been to hospitals, no trace was found. And this pain is now in my knee and my hip bone. When it starts, I can't even walk at all. At times, I think it's spiritual. What can I do? Some say it is my weight. But I have a friend suffering from this same problem, and she is very slim and skinny. Does it mean it is also her weight? Doc, please help me with my leg problem. God bless you for your work."
Amen to the
Yeah. So that's a concern. Before you address it, right, I would have loved to know the age of the one who sent the message. Because tell you what, when I was reading this, I found myself in it. Yeah, like I've got this pain in my leg, in my ankle. It's because I sprained it. But my knee and my hip, sometimes I don't know what caused it. Since like 2012, I've just been, and they tell me it's old age. I don't know if it's old age, but what do you have to say to our listener?
Okay. So what he's describing, it sounds to me like a problem with the nerves and not exactly the leg itself. Yes. And sometimes it's what we call spondylosis. That's where the padding in between the vertebrae of the spine is eroded. So then they press on the nerves that are supposed to be coming out through it. And that will cause pain at the site where the nerve is supplying. So the nerve root is in the spine, but it's supposed to supply the area of the leg. So you will feel pain in the leg, but actually the cause is not in the leg. So you do all the lab tests and x-rays of the leg and you won't see anything. Yes. So basically with that, there are some kind of ways to manage it. We don't really have a cure for those kind of things. Maybe we try to do some physiotherapy and other things, but it depends on the severity of the issue, like what is going on in the spine. It may be something else. I can't be sure. It could be a bone issue internally. We'll need to do further investigations to actually find the cause. One thing I want to say is there are different ways to get an injury or to get a disease condition. So for one person, it might be their weight. For another person, it's the body the posture. Someone is from birth, maybe the spine was already not. So when they get to a certain age, then it gets much worse. Or osteoarthritis from old age. So you might end up having the same problem, but the cause might be two different things. And the treatment too might also be different depending on what the cause is. Maybe if the cause is your chair that you are using at work, probably you would have to change your chair or get something to help to correct your posture, and then that would improve the symptoms.
There's this thing with the nerves. I've forgotten the name. Sciatica, right? It means my problem. So I've heard all sort of things, right? Because one time I had I had this pain in my waist. I couldn't even get up. They had to pick me up, take me to the hospital and all that. But when the pain subsided, I realized that it wasn't actually in my waist. I could feel the pain in my butt area, and that's when they were telling me that it could be the sciatica nerve or something.
Yes.
And
so that's when the sciatic nerve is involved. Yes.
yeah. Were you saying that something like that, you don't really have treatment for it, you manage it?
Yes. Well, as far as I know, we just manage. And
So if I were to go to the hospital, and for the purpose of the discussion, our listener, if he were to go to the hospital, who is he going to see?
well, first you should start with the general practitioner, and then so just the normal general doctor, and then we'll look at your X-rays and other things.
There's nothing in there. I've done these X-rays. There's
X-ray
nothing.
of the spine.
Okay.
Not
Not
of the
of the part that is hurting.
Yes,
Okay.
yes. And
okay.
then probably if it's not very clear, we might have to do a CT scan or an MRI to actually try and find what the problem is. And then if it's something that just needs physiotherapy, a general doctor can just send you to a physiotherapist. We have physiotherapists at the Wejagwa Municipal Hospital, so that will be sorted out over there. But if they think it's too severe and you need to see a neurosurgeon or someone higher off, yes, then would refer you to the necessary places.
I wish that was the topic for today, but that's not, because it's of a major concern to me. But let's look at today's topic, which is stomach ulcer.
Yeah.
I know ulcer to be like a sore or something,
Yes.
and then of course there's a stomach. So I'm going to ask you the question anyway. What is stomach ulcer?
Yes. So as you said, an ulcer just means an open wound. That's
Okay.
all the definition of ulcer is. So you're having an open wound in your stomach. Or when we say peptic ulcer, it's either from the stomach area or the upper parts of the small intestines. Yeah. So basically, those are the places people commonly get ulcers.
Okay. Okay.
Yeah.
What would cause it?
The commonest causes are infection with a virus called H. pylori, Helicobacter pylori,
Okay.
bacteria. Sorry, and it's it actually reduces the it increases the acidity within the stomach, and so there's excessive acidity, and then that causes the damage to the stomach wall. Actually, your stomach wall is supposed to be quite protective and powerful, because the stomach itself secretes acid and all those things in order to digest. Imagine you are chewing your wele or your meat, and then you are chewing.
It's not chewing.
Yes, but then you swallow it into your stomach, but somehow it goes through.
Yeah.
So the stomach has a lot of enzymes and all those things. So once there is overproduction of the acid, or probably the protective layer in the abdominal wall reduces, then those enzymes and acids affect the stomach tissue itself and then lead to an ulcer.
Okay.
Yeah.
What is the relationship with not eating often or a lot, or I don't know what it is, because usually when we hear stomach ulcer, they're saying that the person has not been eating well or something like that. What is the relationship there? Because you're talking of an infection from bacteria, and I'm thinking,
Yes.
okay, what has that got to do with eating?
Well, there are other causes that
Okay.
break down the protection in the inner lining of the stomach, especially what we call NSAIDs, the painkillers that we've been buying over the counter: aspirin, diclofenac, piroxicam, ibuprofen, naproxen. I don't want to mention brand names, but once you look on the box, you see the actual name of the drug, the chemical name of the drug, aside the brand name.
Okay.
So you'll be able to tell. But mostly they are the NSAIDs, and the way they work, a side effect is they break down that protective layer. So if you are always having, maybe, as you said, this pains and all
you're
those
taking
things,
these
you're taking these
painkillers
NSAIDs every single day, they will affect the stomach lining.
Okay.
Smoking, also tobacco, a lot of alcohol
really?
also reduces the protection in the stomach as well. So generally, if you don't eat for a long time, aside the production of the acids and all those things, your body itself comes under stress.
Okay.
And stress is also a factor that also leads to the reduction of the protective layer. So stress, maybe you are overworking, you're not sleeping well, and you are doing so much activity and are not getting time to eat. It's usually the stress that is causing that, and not necessarily not eating, because a lot of people have been doing fasting and prayers and all those things, but they don't have ulcers. So it's not just not eating. but plus the stress and these other associated factors.
Okay. What are the common symptoms of stomach ulcers?
So it's usually the pain that is in the, let me say, the stomach. So the upper part of the stomach, so just underneath the ribs, usually on the left side or in the middle. Sometimes you feel heartburns as well. It's also sometimes associated with nausea, feeling sick, indigestion, a lot of gas as well.
Okay.
Yeah.
But there's a lot of pain that you feel in the tummy, which would not be related to stomach ulcer. So would you need to conduct some diagnostic test to actually establish that there is a stomach ulcer?
Well,
or the presence of an ulcer, let me put it that way.
Yes and no. Sometimes the way the pain occurs is characteristic. So maybe the pain occurs when you are hungry, but when you eat, then the pain subsides. When the stomach is empty and you haven't eaten, so the stomach is waiting for some food, and then the food is not coming. So usually when you see you have that pain, anytime I eat, then the pain subsides. Or sometimes to the opposite. Sometimes they are not having any pain, and when they eat, then they have pain. Yeah. And it's consistent. So in that case, it's clearly a sign. But to find the cause of it, if we don't identify it from maybe just interviewing you and taking the history, probably we might want to do a test for the H. pylori bacteria to see. We can do a stool test, and then we can do the blood test. The stool test is actually more accurate than the blood test, but stool, people are not very comfortable with us. So they do the blood test. Yes. Then we have endoscopy. Endoscopy, that one wants to actually assess the severity of the ulcer, or if the ulcer keeps recurring. So it's like a camera attached to a tube, and it looks on the stomach wall, and then to see if there's an ulcer, if maybe there's some bleeding associated and all that. So the endoscopy would identify that. Sometimes too, if maybe there's a mass or a tumor there which might be causing it, then the endoscopy will also pick that up. Okay.
We don't really have much time, so I'm going to ask you about 2 questions, and then afterwards, if there's anything that you want to add to it, then you do so before we wrap up. What treatment options are available for stomach ulcers?
Yes, so stomach ulcer, most of the time we use what we call proton pump inhibitors, PPI. They reduce the acidity in the stomach. Yes, so generally that's, and then maybe the antacid, that's the normal magnesium trisilicate, or those combination drugs, and all those other things.
Okay. Yeah. All right. Any lifestyle or dietary changes that one would have to go through, especially if they have stomach ulcer?
Yeah, so avoid drinking alcohol, especially in excess. Just one drink a week is fine.
One drink a week. Hey, boys will not be happy with you. One drink a week is fine, eh?
Yes.
So Friday evening we take 1 bottle.
Yes.
And then that's it. What if there's an occasion? If there's an occasion, and then maybe 3 bottles or 4 bottles or.
Well, that means you are taking a risk with your stomach. So
really?
I wish you all the best. Also, spicy foods, smoking cigarettes also is not helpful for stomach ulcers.
Okay. Yeah. Let me ask you this. How long, if one is undergoing treatment, how long would it take to get full cure? And is it permanent, or once you have stomach ulcer, you have it occurring again?
So stomach ulcer is not a chronic illness, or it's not supposed to be a chronic illness.
Okay.
So you shouldn't have stomach ulcer for 10 years and then that's your sickness. No. There are supposed to be treatments for it. So normally for the bacterial treatment, to eradicate the bacteria, you have to take the antibiotics for 2 weeks. A combination of 2 antibiotics and a PPI. You take for 2 weeks, and then after about 4 weeks, we test you again to see if the bacteria is gone from the system. If it's not gone, then that means the antibiotics you took was not able to clear it, so we have to give a different one. The problem is people come and take the antibiotics. They don't test if the bacteria is gone, and then they assume they are fine. Then they get the symptoms again after like a month or 2, and then they assume it's a chronic illness. Probably
the people that I know who have stomach ulcer, or maybe they are the ones saying they have stomach ulcer, they don't really have stomach ulcer. Like, yes, they will tell you they have stomach ulcer. if this what you're saying is anything to go by, then you shouldn't have that.
Yeah, so people are prone to stomach ulcers, but that doesn't mean they constantly have an ulcer throughout. So maybe they easily get it from maybe stress and other things that they do.
Okay.
Or other illnesses. Maybe if you're having a chronic illness, cancer, diabetes, those kind of things, you might be prone to.
Okay.
Yeah.
Okay. Let me just ask this final question. If I have a stomach ulcer, or if I'm undergoing treatment for stomach ulcer, is it advisable to continue with work, exercise, stuff like that?
Yes, you just don't overly stress yourself, but you can actually
I don't need to
your
take
normal,
any sick leave if I'm treating stomach ulcer.
Not unless maybe you are bleeding, like it's a very severe ulcer, but most often what we see, you can just manage as long as you don't overwork and overstress yourself. You can do your normal daily activities.
What if I'm doing like wala to wala side, hard work, labor?
Then you should take some time off, but most often it's not that severe anyway.
Okay. Anything you want to add before we wrap up on stomach ulcer? I don't know. I don't know if I've touched on all the points.
I think we've touched on all the points. So just if you are still having the symptoms after taking your treatment, please go back to the hospital and then test again. Maybe the bacteria wasn't cleared. We have different antibiotic combinations we can use to treat you.
Okay. All right. Thank you very much, Doctor, for coming on the show. It's always great to have you here. Today we looked at stomach ulcer. Don't forget that our text console is always active, 0505751151. You can leave your comment today if you have any question, what have you. You can leave it over there. Doctor, you never do a shout out. Who's listening to you? Give a shout out.
The people are so many.
No, okay, just mention. No, mention 3 people. You know how they say, "Bisa nyuma nipa miensa."
All right, so my colleagues at work, Dr. J, very hardworking. Dr. Cole, my boss, and the nurses at the OPD, Auntie Mary. I worry them a lot.
Okay.
They are very helpful. Yeah.
All right. To all of you out there, make sure to have a beautiful Monday afternoon. Thank you, Doc, for coming on the show. All right, so that was Hello Doc here on the drive with the area gang. We're down 3 minutes after 3.